welcome everybody to this webinar. Some of you might have been on the HRSA webinar yesterday, which was more of a walkthrough of the Notice of Funding Opportunity, or the Nofo. But today we're going to get into some specific tips on areas that are relevant to the Family to Family Health Information Center, Nofo. So my name is Lisa Maines, and I'm a project director for Family Voices National, and I'm going to moderate today. Diana Autan, co-director for the Family Voices Leadership in Family and Professional Partnerships project, will be your presenter. The slides and the recording of this webinar will be available on the Family Voices webpage that is dedicated to the resources for this Nofo. We'll give you a glimpse of that at the end of the webinar, and I'll also put the link to it in the chat momentarily. If you have questions during this presentation, if you could please enter them in the chat box, or at the conclusion of the presentation, you can raise your hand and we'll call upon you to ask your question. The raise hand function is at the bottom of your screen, Zoom screen. When you raise your hand, we'll let you know when you're unmuted so that you can then go ahead and ask your question. And today's agenda, we're going to first take a look at addressing diversity and disparities in your needs assessment, and then also your methodology. And after discussing those really important pieces of the application, we'll open it up to your questions. So thanks so much for joining us. And I'm going to pass off to Diana Autan now.
Thanks, Lisa. I'm really happy to be able to talk with all of you about these critical resources that we're going to be discussing today about diversity and disparities and equity. Before we go to the specific sections of the Notice of Funding Opportunity, which I'll call the Nofo, I just want to give a little bit of context that's also included in the Nofo from the Maternal and Child Health Bureau. And I'm going to really highlight the components of the introduction to the requirements for the proposals that emphasize the Maternal and Child Health Bureau's commitment to addressing diversity and disparities to increase health equity for children and youth with special healthcare needs and their families. So in the introduction to the proposal requirements, the Maternal and Child Health Bureau, which I'll call MCHB, specifies that recipients that are funded under the F2F program are expected to integrate some key family professional partnership program principles throughout all of the project policies and activities. Children and youth with special healthcare needs and their families should receive care in systems that are family-centered, culturally and linguistically appropriate, and which promote shared decision-making between families of children and youth with special healthcare needs, health professionals, and appropriate state and community organizations, and use a strengths-based approach that supports improved quality of life factors for children and youth with special healthcare needs and their families. Again, MCHB reiterates that the approach must be family-centered, culturally and linguistically appropriate, and promote shared decision-making between families and health professionals and appropriate state and community organizations. Even in the program objectives, MCHB highlights their commitment to F2Fs really focusing on equity, diversity, and disparities in the applications and in the work. There are three main program objectives. The first of which is increasing by 10% from the baseline the number of families of children and youth with special healthcare needs and professionals who receive information, education, and/or training from family-to-family health information centers, which I'll call F2Fs. The second objective is increasing by 10% from baseline the number of children and youth with special healthcare needs and families from underrepresented and diverse communities trained to partner at all levels of shared decision-making. And then the third is the number and type of state agencies, programs, and community-based organizations that are assisted to provide services and information to families of children and youth with special healthcare needs. The Nofo also includes brief information about MCHB's strategic plan goals, which include assuring access to high quality and equitable health services to optimize health and well-being for all MCH populations, achieve health equity for MCH populations, strengthen public health capacity and workforce for MCH, and maximize impact through leadership, partnership, and stewardship. They also note that F2Fs help address those MCHB goals by advancing a well-functioning system of services in which families and health professionals partner in healthcare decision-making, by seeking to address health inequities and meet the needs of diverse and underserved families, and by providing education and training for health professionals on how to work with parents and families of children and youth with special healthcare needs. The Nofo continues to highlight MCHB's laser focus on equity, diversity, and disparities when they note the significant disparities in access to high quality care. For example, they note that only 9.3% of Hispanic children and 14.4% of Black children report receiving care in a well-functioning system, compared to 15.6% of white children. They also note coordination needs that go unmet more frequently and lower satisfaction with the care they receive, as well as the barriers that are posed by language and cultural differences. They also mention that F2Fs enhance partnerships with diverse and underserved communities, promote health equity by disseminating culturally and linguistically competent materials and resources in multiple languages, conducting outreach to culturally diverse communities, partnering with nonprofit groups that represent the interests and needs of ethnic and cultural minorities, providing support groups, and interacting with members of specific communities to coordinate trainings. It's important to note that in MCHB's definition, underserved communities include Black, Latino, Indigenous and Native American persons, Asian Americans and Pacific Islanders and other persons of color, members of religious minorities, LGBTQ persons, persons with disabilities, persons who live in rural areas, and persons who are otherwise adversely affected by persistent poverty or inequality. They indicate that addressing issues of equity should include an understanding of intersectionality and how multiple forms of discrimination impact individuals' lived experiences, and that individuals at the nexus of multiple identities often experience unique forms of discrimination or systemic disadvantages, including in their access to needed services. So I think it's pretty clear when you look at the introduction to the various sections of the Nofo that applicants for the F2F funding must address, that MCHB is very, very laser focused on these issues of diversity, disparities, and equity. Next slide. So let's talk about the needs assessment section of the Nofo. In the description of the needs assessment section of the Nofo, it talks about describing the target population of families to be served, the specific needs for families as identified by families and key stakeholders, sociocultural determinants of health and health disparities, documentation of unmet needs, needs related to health insurance and improving outcomes, demographic data of the population to be served, including geographic, economic, racial, ethnic, and linguistic data, quantitative and qualitative data, so numbers and qualitative information, data from past activities, data from the National Survey of Children's Health, and from the Title V Block Grant Needs Assessment and Action Plan from your jurisdiction, state, territory, or District of Columbia. So let's just talk a little bit more about what is required to be addressed in this section, the needs assessment section. So in describing the targeted population of families of children and youth with special health care needs to be served by the proposed project, it needs to include the specific needs for families in accessing health and related services as identified by families of children and youth with special health care needs and other key stakeholders, those sociocultural determinants of health and health disparities, and documentation of the target population's unmet needs related to the program purpose. So it needs to also include a description of the agencies that serve children and youth with special healthcare needs in the state or territory, tribal community, who can serve as partners. That demographic data of the population to be served, including geographic, economic, racial, ethnic, and linguistic data, should be included and cited whenever possible to support the information that is provided in this section. When they talk about the relevant data, that can include data from past and current activities, the National Survey of Children's Health, Title V block grant activities supporting children and youth with special healthcare needs, and any other sources that can be used, they really talk about trying to make sure that that data is as relevant as possible and as up to date as possible. So for example, when they talk about the National Survey of Children's Health, they're not looking for any information from years ago, they're looking for the most recent data from the National Survey of Children's Health. And when they talk about looking at your Title V block grant needs assessment and action plan, just remember that last year, every Title V agency did a 5-year needs assessment. And this year they've submitted an updated needs assessment to kind of update those needs from that they've been able to hone in on over the last year. And then the priority needs that they've identified both as part of last year's block grant needs assessment and the updated information for any updated needs, as well as an action plan. And remember that that data from the National Survey of Children's Health, as well as the Title V block grant needs assessment and action plan, really looks at data from a variety of lenses, including race, ethnicity, language, geography. Are there particularly unmet needs in rural areas or in tribal communities that are in the state or territory? So, when you're looking at that data, even though the data can give you, for example, in the National Survey of Children's Health, what % of families of children and youth with special healthcare needs are reporting that they have access to a medical home or effective transition. You can also look at that data and should look at that data given the focus in the Nofo on looking at and addressing and helping to reduce disparities. Look at that data by race, by ethnicity, by language, etc. So let's go to the next slide. So some of the processes, tools, and sources for needs assessment that really hone in on this disparities and diversity information include a disparities impact tool, which can be used by healthcare stakeholders to achieve health equity for racial and ethnic minorities, people with disabilities, sexual and gender minorities, individuals with limited English proficiency, and rural populations. And the very first of the 5 steps start with identifying health disparities and priority populations. So let's just go take a look at that disparities impact statement tool. And one of the things that the Nofo requires successful applicants to do after receiving the funding is to actually complete a disparities impact statement. But to have a successful application to serve as an F2F, you can't wait until then to do the first step of the disparities impact statement, which is identifying health disparities and priority populations. And so it's good to look at the disparities impact statement and use it. It has some resources that you can look at to identify health disparities and priority populations, but also think about the steps of developing a disparities impact statement, because this is going to be something successful applicants will need to do once receiving the funding. So Ian, let's go back to the slides. And so another critical tool is language access self-assessment. And language access self-assessment is not something that you can wait until receiving the funding to do. This is something that's really critical as part of your needs assessment. So let's go to the first hyperlink, the Know Your LEP Population with the Language Map app. One of the resources that is very, very valuable for working with families and others that have limited English proficiency, also known as LEP, is lep.gov. lep.gov is created by the Interagency Working Group on LEP. So it's all the federal government agencies And they have resources for people about both assessing the limited English proficient population in the area that you're serving, as well as how to address and meet the needs of those individuals. So they have a wonderful new language map app that you can access that makes it very easy to go to your state or territory, the District of Columbia, your jurisdiction, and look and find out information on the individuals with limited English proficiency in your catchment area. And now let's go to another tool, which is also on lep.gov. And this was developed in May of 2011, but it's just as valid today as it was in May of 2011, and probably even more important, because one of the things that you will find when you look at the LEP population map is that you've probably got a lot more people who have limited English proficiency and probably a lot more languages than you had 10 years ago after the last census. So this tool is a wonderful tool to both assess the need for language access in your catchment area and also plan to address that need for language access in your catchment area. And of course, that's one reason why you can't wait to see if you're funded in order to do a language access assessment and develop a plan, because you need to be able to report on the limited English proficient individuals in your catchment area, what the needs are, and also the ways that you're going to be able to address those needs. So let's go back to the slides. And the next tool that we're going to talk about is the Centers for Disease Control and Prevention Social Vulnerability Index. And I want to say that this index uses US Census data to determine the social vulnerability of every census tract. Census tracts are actually subdivisions within counties for which the census collects statistical data. So it ranks each tract on 15 social factors, including poverty, which is a critical factor. You heard about poverty when we discussed the context that MCHB provided before getting into the specific areas that you have to address in the application. So poverty, lack of vehicle access, crowded housing, these are all critical areas that you need to be aware of. It was developed in order to help jurisdictions, census tracts to look at vulnerability in cases of public health emergencies and weather emergencies, etc. But it's very useful. The 15 social factors are very useful in assessing the needs of the population in your area. So let's just go and take a quick look at what that looks like. So here's what it looks like. There's a fact sheet. We're not going to go any deep. We're just going to show you what it looks like. It's the Agency for Toxic Substances and Disease Registry. And so it tells you what social vulnerability, talks about potential negative effects on communities caused by external stresses on human health, including natural human-caused disasters or disease outbreaks, etc. So there's an interactive map that you can explore. There's a fact sheet. They've even got a data and documentation download, which, some of us find it easier to look at and use the interactive maps, and some of us find it easier to look at the data and documentation download. But this is really a great resource that's very, very useful, even outside of the context of the F2F application. So let's go to back to the slides. So we're next going to look at census data. And before we go and look at these, I want to say a couple of things. The census data is, which was from 2020, is going to be reflected in the American Community Survey data, which we're going to kind of look at next in November. It's not ready now. So, you can look at a lot of these other data and start using that data for your needs assessment. They do have American Community Survey data from 2019. They'll be updating it with the 2020 census data they promised by November. So let's go. We're going to look at 3 different quick things, and we're going to start. And these you can also find this data from the lep.gov site. So here is the American Community Survey data. So the American Community Survey, also known as ACS, is the nation's leading source of large and small area socioeconomic and demographic statistics for all levels of geography for every community in the US and Puerto Rico. So December 10th, 2020, they released new 5-year statistics. And for the first time, the data from the 2015 to 2019 American Community Survey will allow users to compare 3 non-overlapping sets of 5-year data. So 2005 to 2009, 2010 to 2014, and 2015 to 2019. So that can help you identify trends, particularly for small communities and geographies, which is critical for planning future investments and services, including family-to-family health information centers. So the American Community Survey data is really critical. Let's go to the next. So this is a wonderful resource. It's a resource for entities that are covered by Section 1557 of the Affordable Care Act. But one of the great things that it does is that it tells you the top 15 languages in every state and the District of Columbia and the US territories. So here we have Alabama, and at a quick glance, Alabama, you'll be able to see the top 15 languages that are spoken in your state and the numbers of people that they estimate that speak those languages. So you can see that if you're going to focus limited resources, you're definitely focused on Spanish. But how many people would have known off the top of your head Chinese has 5,405 people, and Korean 4,554 people, and Vietnamese 3,708 people, etc. And one of the important things is when you do your language access planning based on your language access self-assessment, is that anytime you're going to serve a jurisdiction, you have a certain number of people that speak that language in your jurisdiction. Those are the languages that really are required to be, where you're required to translate materials into those languages. And so this tells you at a glance the top languages in your jurisdiction and the numbers that are estimated, and then you can figure out whether or not you've got enough people that speak that language where you really are needed to provide information in the language that is the priority language. So let's go to the next one, which is exploring your state. And this is a great resource also from the census, where you can just look at your state. So this is, kind of overall by the United States, but you can actually do a state by state look, and just at a glance, you'll be able to see race, ethnicity, and population by age range, and a variety of other important information, education, income and poverty, housing, health, etc. So it's a great, you can spend lots of time looking at this, but really at a glance, it can give you some really critical information that you'll be able to use when you do your needs assessment. So let's go back to the slides. And now let's talk about addressing equity and disparities in your methodology. So again, in the methodology, the Nofo really highlights some critical ways in which you must address equity and disparities in your methodology. So the methodology says that you have to address the statutorily required activities that you have to do. These are the things that F2Fs have to do because they are part of the statute that funds us. And the first one is helping families make informed choices. So when you describe your methodology about helping families make informed choices, you can't just talk about generic methods that you're going to use to help families make informed choices. How are you going to help families that represent the full diversity in your community, your state, your territory, DC, as well as families whose children experience the worst outcomes? How are you going to provide information? Again, not just generically to all the populations of families of and youth and young adults with special health care needs and the professionals who serve them, but including information that's important for those families who have the least access and the worst disparities. Identifying successful healthcare delivery models. Again, not just generic healthcare delivery models, but what are the healthcare delivery models that have been effective for underserved populations? And what are the models for collaborations that make sure that your collaborations include collaborations that will address the needs of underserved populations? The same is true for providing training and guidance and conducting outreach. And of course, this is going to be one of the most important areas where you really have to disaggregate not only your data, but also your activities. How are you going to make sure that you reach those populations that are the hardest to reach for whatever reason? Lack of literacy, lack of limited English proficiency, being in remote rural areas, having limited access to technology. Even when you talk about, staffing by families and health professionals, how are you going to make sure about the families that, of course, we, I think from the Nofo webinar that was done yesterday, I think it's pretty clear that staff of F2Fs meet the requirement of health professionals with all the knowledge and expertise that we have about healthcare, et cetera. But how are we going to make sure that we have staffing and volunteers that can appropriately reach and serve the most underserved families? And then they also talk about additional activities that have to be addressed in the methodology. So these additional activities include partnerships. So again, how are you going to make sure you have partnerships that are with organizations that already are serving the most difficult to reach, the most underserved or unserved families and children and youth with special healthcare needs? Here in the methodology, you're going to discuss how are we going to develop a plan to develop a diversity and inclusion plan. So that plan, the diversity and inclusion plan itself, is not due until after the F2Fs are funded, but the plan to develop it has to be included in the methodology. And so the plan for developing that diversity and inclusion plan has to address the inclusion of underrepresented populations, which they define as rural, urban, underserved families by race and ethnicity, by disability, by gender, by sexual orientation, by family structure and socioeconomic status. So how are we going to make sure in the methodology that we have things set in place to be able to develop an appropriate diversity and inclusion plan? We also have to talk in the methodology about collection, monitoring, analysis, and reporting on data, and also identifying meaningful support and collaboration with key stakeholders in planning, designing, and implementing all activities. So this has to include, and they specifically mention, identifying meaningful support and collaboration with those key stakeholders, including the extent to which these contributors reflect the cultural, racial, linguistic, and geographic diversity of the populations and communities served. And I want to mention that this support and collaboration with key stakeholders has to include development of the proposal. So again, we can't wait until after the proposal is developed and submitted and we're funded in order to make sure that we really have this meaningful support and collaboration with the key stakeholders that also include the diversity of the partners and stakeholders and families and youth and professionals that represent these diverse populations. So before we go to the next slide, I just want to mention two important resources for addressing equity and disparities in methodology. So let's first go to the class standards. And these are the National Culturally and Linguistically Appropriate Services Standards. So the principal standard of the national class standards, which you can find at Think Cultural Health, is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. And then it goes through all of the other class standards. And it's important to be aware of those class standards in developing your methodology to make sure. Now, we don't have to have a proposal that goes into the way in which we're going to address every class standard. And not every class standard is directly related to the work that F2Fs do, but many of them are. So for example, how are we going to recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce that are responsive to the population in the service area? So it's important certainly to address that principal standard, which is the most important and basic standard, but looking at governance, leadership, and workforce, communication and language assistance, and the other main categories will be important when we are looking at our methodology. And then the other tool that I want to really introduce you to, if you're not aware, is the Cultural and Linguistic Competence Family Organization Assessment, which is from the National Center for Cultural Competence at Georgetown University Center for Child and Human Development. If you're applying and you are not a family organization, they also have one for disability organizations. But I want to talk just briefly about the Cultural and Linguistic Competence Family Organization Assessment. They also have a guide. And this tool was actually developed in collaboration with family organizations, including parent centers, family-to-family health information centers, Federation of Families for Children's Mental Health affiliates, parent-to-parent programs, and others. So it really, this one is really focused on the things that are important for family-run, family-led organizations to be aware of and to assess. And then the one for disability organizations was done in collaboration with disability organizations. So that's also a great and very appropriate self-assessment that was, developed in collaboration with the organizations that it's intended to help. Again, for this, the self-assessment document has some major areas that you would, even if you're not going to do the self-assessment before submitting the application, looking at the areas under the self-assessment and just thinking about how those different areas impact your organization's ability to be able to effectively and appropriately serve the various populations, particularly those underserved populations that you're going to address in your methodology. So let's go to the next slide. And I'm just going to talk quickly about two other areas where equity and disparities must be addressed. One is in the evaluation plan and the other is the organizational information. So in the evaluation plan, you have to talk about strategies to identify and use appropriate data sources and collect and analyze data that will measure the outcomes and impact of your project, including collecting, analyzing, and tracking data to measure outcomes of the project on different sociocultural groups, such as by race and ethnicity and language. So you can't, again, just talk about, oh, we're going to collect data, from 100 families that have used our services. How are you going to make sure that you are also looking to make sure that families of all different groups, including the most underserved groups that have the worst outcomes, are also benefiting equally as well from your services? It also has to address mechanisms to monitor and evaluate the efficiency of your proposed project activities and process. So, how efficient are they in reaching and serving effectively all the populations in your catchment area, including underserved families? And then an explanation of how the data is going to be used to inform and improve the quality of ongoing program development and service delivery. Again, you can't just rely on overall data. How is it going to inform and improve the quality of your program development and service delivery for the most underserved children, youth, and families? And then in the organizational information, you have to provide information on your organizational mission and vision and structure and scope of activities. So you're going to want to talk here about how is your organization currently reaching and serving underserved families? What does the diversity of your workforce look like? What are the proven and successful leadership roles that you have had in the areas that are required to be accomplished by F2Fs? Even if you're not an F2F, you're applying to be an F2F. So looking at the requirements for F2Fs, what has your organization already done and shown leadership in those different focus areas? That you're staffed by families with expertise in the required areas and also in terms of health expertise. Again, how are you going to make sure that you're staffed by families that reflect the diversity, or that if the F2F funding is very small, how are you going to engage families from diverse, underserved backgrounds and provide them with stipends or ways to be able to share their expertise with you. Your organization chart and your staffing plan, and then organizational information must also include specifically resources and capabilities that you have to support the provision of culturally and linguistically competent health literacy services. So at this point, let's go to the next slide, Ian, and let's open it up for questions.
Thanks, Diana. So just a reminder, you can, I haven't seen any typed in the chat box, but you can still do that, or you can raise your hand and we can unmute you and answer any questions that you might have. While we're waiting for people to do that, Ian, perhaps we can just take a look at the website, the webpage. And I know many of you have asked for links for me to put them in the chat, and that was a little complicated for me. So rest assured that those will be available to you on our webpage, which Ian has graciously put up on the screen here. So this page is on the Family Voices website, and it's a page of a variety of resources that will be available to you that relate to the application. So you can see right there, just above that blue box that says following is a collection of resources, is the link to the actual Nofo itself. So that will be handy for you. And then to the right of that, it says on this page, and it has those 5 areas. And so those are, this page is really an alive document. So we are adding to this as we get new information. I'm sure when the additional information comes out from HRSA, we'll link to it on this page. So it's not a page that you'll want to go to once and then never go back to, because it may change. So, but if you look at those areas and those links right there, you can click on, like Ian, if you would just click on the logic models, because who doesn't love a logic model? And it'll take you down to all of these resources right here for logic models, because if you haven't done a logic model before, it's kind of there's a whole bunch of information right here to help guide you through that, and that's just one example. So all of those different areas have various links. We will also have the link to the recording for this webinar on this page, as well as the PowerPoint, which has all of the resource links that Diana's been talking about. So, so that's that. And actually, I can put the link to that page. I think I have that ability.
And I see we do have 2 questions so far, Lisa, in the chat.
Okay. Do you want to go ahead and read them
Sure.
out loud? Okay.
So the first one says, there seems to be a new emphasis on healthcare professionals on staff. Given the normal pay rate, how can we, for F2Fs, for healthcare professionals, how can we justify having fewer family compensation dollars? So I just want to highlight that on the webinar yesterday, they clarified that families who have this healthcare knowledge and expertise can be considered healthcare professionals. This is not a new emphasis. This was in the last Nofo as well, because it's actually in the statutorily required. It's statutorily required to have family members and and healthcare professionals. But we've spent a lot of time ever since the F2Fs have been around at with the the Family Voices TA Center, whatever it's called now. It's called LFPP. It's been called different things. Really highlighting that F2F staff are part of the MCH workforce, and I think that's been very clear. I don't think there are very few F2Fs that actually have people that have quote unquote healthcare professional letters after their name. And so I would not worry about that at all. It was clarified yesterday. I'm sure it will come out even clearer in the FAQ that will come out from yesterday's webinar, but don't worry about that. Do you want me to do read the next one too, Lisa? Or you want to
I can go ahead and read it. So Ilka has a question. And she is saying, given that the proposal can only be 50 pages total, how would you say best to summarize the narratives on cultural and linguistic competence? There's not very much space. Good point, Ilka.
So this is what I would say. I would say that it's all about integrating that into everything that you write about. So when you talk about your needs assessment, don't just say this is what the National Survey of Children's Health said about transition. Say this is the overall data, and this is how, families of color compared to white families, or families who don't speak English compared to families whose primary language was English. And so, it's really about doing what we need to be doing as organizations anyway, which is really reflecting this focus on those who have the least access and the poorest outcomes in everything that we do, and in everything that we write and everything that we talk about. So it's not so much about having a huge section on each of these areas. It's really about doing what MCHB did, which was integrating those components into everything that every section of the application that we write. So when we write about our staff, if our staff include an individual who speaks Spanish, we'll say the project will have two staff, one is Spanish speaking, one's African American, or just ways to, whenever you talk about every section, just make sure that you are addressing that information. Another thing to do is when you talk about training, the organizational qualifications, and you talk about the training that you provide to staff. All staff receive training, including in working with diverse populations and working with interpreters. Again, just that's one of the reasons why we wanted to really hone in on this aspect of the Nofo, because it really needs to be not separate parts of each of these sections, but really included in how you address each section. And I think there's another question that was asked about what's new. A lot of what we just talked about is new. There always was some focus on underserved families, but the extent to which diversity, equity, disparities is addressed in this Nofo is much more significant than in any previous Nofos. And the need to do that, that equity, that diversity, equity, that impacts plan has never been a requirement for F2Fs in the past. So it's very clear that this is an elevated priority within this administration and within HRSA and MCHB.
Thanks, Diane. I'm not seeing any hands up, and it looks like we've answered all of the questions that I'm seeing here. I just want to say, if anybody thinks of any questions after we sign off today. Oh, looks like Sandra's got her hand up. Ian, could you is Sandra unmuted?
Yes, she is ready to go. Whenever you're ready.
Thank you.
So Diana, I got distracted, and you said, could you repeat what you said about this being the first time it was put into the grant? It was really your last statement that you made.
Yep. So one of the things that has to be done as part of, if once you get the once somebody is funded to be the F2F, you are required to do a specific plan, and that there's a link to that plan in the application. We actually talked about it in the when we talked about the needs assessment. because the first part of that plan is the needs assessment, but it is a plan that is a disparities impact statement and a plan to address that. And that is going to be something that's required to be done by every entity that is funded to be the F2F. And so but in the methodology, you have to talk about how you're going to develop that. So you can't wait until, you have to be aware of what the components of the plan are, and there are 5 steps to it. I don't know, Ian, could you quickly go back to that, to the link that is to that plan?
Yes, could you just remind me the title of which that one will be?
It's the, it is the, I think, go into equity assessment and planning, go down to that. And so you see the disparities impact statement. That's it. And Nafi, you're just going to be able to go to the website. The website has all these links. So this is the 5 steps. And the first one is identify health disparities and priority population. So this is the thing that you're going to have to do once you get funded. And so you're going to want to be able to address how are you going to do this? And remember, how are you going to engage the very populations that are the most underserved in doing this disparities impact statement? The first step of which is identifying health disparities and priority populations, but including define your goals, establish your health equity strategy, determine what your organization needs to implement its strategy, and monitor and evaluate your progress. So this document also has some hyperlinks in it that are also very useful. So you don't have to do this whole thing, in writing your application, but the first step, it really needs to be done as part of your needs assessment. So this is the first time you have to do this, but everything in the entire application has a much more focused inclusion on diversity, equity, disparities throughout every section of the application, including in the introduction to the application. Did that answer your question?
Yes, thank you.
Great.
Thanks, Diana. So again, all of this is available on that webpage. I've thrown a couple things randomly and into the chat box as I could, but just a reminder, it's all available on the website. And also, just if anybody has any questions after we sign off today, Diana and my email are available on the screen and will be in the PowerPoint that will be on that webpage. So we are here to provide technical assistance to anyone applying for this grant. So please feel free to reach out to us with questions, and we're going to be trying to, stay tuned to all of the things as they come out and to make sure that we share them on that web page for anyone to see. So it looks like we have no more questions. So I think we are all set. Everybody knows exactly what they're doing now.
Thanks, everybody.
Yeah, thanks everybody for being here.